Your area of expertise?
My area of expertise is in the treatment of children and young adults with depression, anxiety, post-traumatic stress disorder, using evidence-based practices like cognitive behavioral therapy and mindfulness.
Tell me a little bit about the Trails to Wellness program. Who is it geared toward?
Trails began after a number of schools in the Ann Arbor area came to the Depression Center at the University of Michigan and said that they were really feeling overwhelmed with the number of kids that were presenting with mental health concerns and also the severity of those mental health concerns. And they had a number of staff who were excited and motivated to support those students and were great at building relationships with teens and could relate to them well, but they did not feel equipped with the training or tools to provide those teens with evidence-based mental health care. So we started a training and implementation support program. And today that program is in many, many of the 83 counties in Michigan. I think over 65 of the counties in Michigan today have the Trails program embedded in a school in that community. And the program provides training and resources and coaching for school professionals to help them deliver those best practices with their students.
Now, I understand that you may be in the phases or one phase of a pilot program where you're studying this. How many students and families are involved and what you're doing to take a look at the program?
You could say that we are almost always in a phase of a pilot program, in part because we are always learning from our community partners and we are always tweaking what we do. But in fact, we have been just completing in the last couple of months a NIH-funded clinical trial in about 100 Michigan schools spanning 65 counties, and that each school engages somewhere between 10 and 20 students, so approximately 1,000 students and their school staff have participated in the study. And we were looking at whether our model of providing this training and post-training support through coaching and implementation support, technical support, leads to more frequent delivery of best practices by those school professionals, as well as improved clinical outcomes among the students being served by those staff.
Are they using a lot of CBT, the cognitive behavior therapy, or what's involved in this pilot study?
The purpose of Trails is really to bridge evidence-based mental health practices with those school professionals who are seeing kids on a daily basis. And cognitive behavioral therapy really does have the strongest evidence for improving mental health outcomes. So we teach them 5 or 6 core practices that all come from cognitive behavioral therapy and mindfulness. And we really try to focus only on those skills-based approaches. We know that many principals don't want their school psychologists and school social workers doing therapy with a capital T, but they really do want their staff teaching kids core coping skills that they think are going to be effective and help them function socially, personally, and then of course academically.
In light of the pandemic, how important is this information going to be in the new school year, and having those resources available to the schools and to the kids and to the parents and to the counselors?
At Trails, we thought it was important before COVID. Our philosophy was that every kid in every school should be learning effective coping skills. Before COVID, we already had a public health emergency on our hands. Kids were experiencing really alarming levels of depression and anxiety, and many kids were going off to college not having developed a set of skills that could help them navigate typical stressors, academic pressure, social pressure, rejection, failure, all those experiences that are part of life and are very difficult. And so we really felt that every kid could benefit from those skills. Now we have a completely unknown future. And as these kids are graduating, college looks different, the workforce looks different. And so it is so essential that they have some tools in their toolbox to help them cope with whatever they are feeling. That may be depression and isolation, it might be overwhelming anxiety, it might be sleeplessness, it might be fatigue. So whatever emotions that this situation is bringing out, it is so important that they have coping skills to help them navigate this new future.
What should parents be aware of right now? What should they be looking out for, especially in their 2020 grads who have missed a lot of these milestones?
I think it is a really troubling time for many parents, and I think that many parents feel that they really don't know how much to ask and how much to push. because typical development for teens would mean a lot of separation and a lot of reliance on their peers, and that may not be as possible. I think one thing that parents can look for is, are they seeing massive changes in the way their children are presenting? So is a kid who used to be motivated and exuberant and upbeat now just sleeping until 2 in the afternoon and feeling really, withdrawn and quiet and down? I think there are ways that kids can continue to be social right now. They can certainly communicate via technology or the phone. They can get outside and get exercise and go for walks or bike rides or jog. So there are things that they can do. And if you're seeing your child just not take advantage of those opportunities at all and not really have any openness to shifting into these new strategies that are available to them, then I think that's more concerning.
And is there anything in particular that you would want to say to parents of teens in that situation?
I think just recognizing that what they are experiencing is probably not that different from grief, that we can't take away this experience that they're going through, in which so many things that they were looking forward to are now not possible. And so many things are not what they imagined and were looking forward to and anticipating. And so I think just recognizing and validating how significant of a loss that may be for some of them. And I think really treating them and ourselves with some kindness and compassion, to say, this is a situation that no one knows best, how to navigate. No one knows how long it's going to go on for. We certainly didn't have time to prepare for it. And if you are a parent of a kid who is not coping well, I would say, remember to have some kindness and compassion. That doesn't mean apathy towards trying to cultivate some better habits, but I think just some kindness and compassion to say, let's take this one day at a time and remember that they are really experiencing grief, and we have to give them some space to grieve and to experience those emotions.
On the flip side, is there anything that parents can say to help their kids think about resilience and what we've learned from this and how it will help them in the future?
I think the good news is that, as I mentioned a moment ago, we have always wanted kids to develop good coping skills. And this is an opportunity for parents to really support their kids in developing those skills. So one thing that parents can really help with, I think, is encouraging their kids just to develop awareness of how they are coping. That sometimes we're coping in ways that we don't even notice. And your 17-year-old kid might spend 3 hours on a video game and not realize that that was their attempt at coping. And so just to develop awareness with your child and to say, let's look at how we as a family are coping. Here are the things I'm doing. Model that sort of self-reflection and say, when I feel overwhelmed, I go for a walk. Or when I feel really lethargic and unmotivated, I force myself to go for a run even though I don't want to. What are you doing? Tell me about what you're doing, because the coping strategies for something like this, there is no one size fits all. There are many, many different ways of coping. And I think we really want to just encourage parents to talk with their children and encourage their children to do that self-reflection, to understand how they are coping.
Are there any of those resources on the Trails to Wellness website that we didn't talk about that you want to highlight or make sure that people know about?
We did talk about the Self-Care for Teens document, and I think that is a really helpful document. It was created with our school professionals in collaboration, really thinking about the strategies that they think will resonate with teens. So I think that is one document that I would encourage parents to take a look at. There is a parallel document that is in there just as a tool to help kids build their optimal schedule for the day. I think, at the very beginning, there were a lot of people, myself included, who said, it's all about structure the whole day, make sure every hour has a purpose. And I think on reflection, really what we want to do is, yes, we want to use a schedule, but we want that schedule to be filled with a really big variety of things. So some of the things on that schedule may be academic, achievements and goals that kids need to complete before the end of the year, or planning for the upcoming fall, tasks, chores, ways to be helpful around the house. But we also want them to be scheduling in time for recreation and socializing and things that bring them joy and things that, get them moving and up and out of the house. So the tool on our website is a sort of a schedule builder that encourages kids to look across the spectrum of body, mind, and spirit and fill their day with a wide variety of activities that are really meant to help promote their optimal wellness, not just get them completing all their academics.
Is there anything, Elizabeth, that I didn't ask you that you want to make sure people know?
I think the only other thing I would add is this situation unfolded so rapidly that often there were a lot of people that just had no capacity to strategically plan how they were going to respond, how they were going to deal with their overwhelming emotions. And it is really normal and natural to reach for a coping skill that brings immediate relief. And often those coping skills are not the same coping skills that we would want to cultivate into habits. So I would say, as you're talking with your kids, a great question to ask them is this coping skill that you're utilizing something that you would like to grow into a habit? Or is this a form of distraction? And there are, pros and cons to every coping skill, but some of them have some significant downsides, right? So when we see kids engaging in substance abuse or compulsively reading the news, kids and adults, right? We can all be very guilty of compulsively checking the news over and over and over again to make sure we're staying up to date. So reaching for coping skills that don't necessarily bring immediate relief, but set you up for long-term wellness and mental health, I think that would be a great starting place for a conversation with kids.